Chlamydia is the most widely spread of all the sexually transmitted infections. Women are the majority of victims, accounting for about 80% of all cases, and its rate of infection has been rising steadily over the years. In general, chlamydia does not present recognizable symptoms until it degenerates into a serious medical condition that can result in hospitalization. At that point, young women are at risk for becoming sterile. That is why the world's most respected medical research center, the National Institute of Health in the United States, has declared that it is urgent to develop a means of allowing women to self-sample for chlamydia at home. Marjorie had had an unprotected sexual encounter. Wanting to protect herself against the possibility of chlamydia, she decided to get tested. She imagined all the possible scenarios. 1. Not get tested, which could result in serious illness, including hospitalization. 2. Seeing a doctor at a clinic involved a loss of time, as well as embarrassment. Visiting the crowded clinic would result in her being seen by many people. After some thought, Marjorie decided to order the mini pad that sweeps away chlamydia via the internet in order to be tested. She found the method easier, less trouble, and more private. Above all, there was scientific proof of the procedure's efficiency. After having worn the special mini pad, Marjorie mailed it to our microbiology lab where the specimen was analyzed under strict quality controls. The test is just as valid and effective as that offered at the clinic. Several days later, Marjorie phoned our lab and identified herself using only the unique code she received with her mini pad. Marjorie was delighted to learn that she was not infected with chlamydia, and she resolved to be more careful in the future. She had already found advice on the different methods of protection she could employ during her future sexual relations. Women who test positive are directed to see a doctor for treatment, both for them and their partner. The prevalence of chlamydia will diminish with the increased participation of women in testing campaigns and through the work in prevention done by BEO ITS Incorporated and its partners in the Public Health Network.